Well, good evening, everyone. We're actually here today to talk about the budget cuts and the votes that we took this week. This week was an extremely challenging week for all of America. The House Republicans put forth a bill. This bill actually called for $880 billion in cuts to Medicaid. This could only be possible if in fact they touch Medicaid throughout more than $600 billion. So let's go through some facts about what has been said today. As of such, so far, we've heard several proposals and several Republicans make several statements saying that Medicaid is not mentioned within the budget. However, when we looked at it, the budget actually calls for $880 billion in cuts. Now, in order for them to reach that number, they would have, if they cut everything in energy and commerce, they would still have to cut $600 billion in Medicaid to get that number of $88 billion. So even though it's not stated completely, it is in fact a fact that they would have to touch it. Cuts to Medicaid were the only way for the Republicans to hit their goal in the federal funding slashes. A leaked memo from Republicans shows detailed proposals to drastically cut Medicaid. Where will the cuts land? Now, this is what we're going to talk about today with all of our constituents about where will we see these cuts. Now, remember, I told you over $600 million in cuts, billion dollars in cuts will be there. Most of them are going to be our most vulnerable, specifically our children, adults, seniors, and people with disabilities. In the state of Florida, we could stand to lose $2.3 billion in Medicaid funding if the current budget proposal goes through. At this moment, I wanted to talk to several people and bring their stories to light during this town hall. When healthcare coverage is stripped away, people are forced to decide between paying their prescriptions or putting food on their table. If these Medicaid cuts go into effect, the tireless nurses and doctors at our community health centers who serve our most vulnerable residents may have to close their doors, lay off staff, or cut access to critical services. This is the reality for so many families, and some of these stories are gut-wrenching. And so today we'll hear from some of those families, but we also wanted to draw attention to what's actually going to be happening to Social Security and Medicare. Already we see these cuts have been having a substantial effect on the Social Security office as far as laying off and firing our federal workers. So we have someone here to speak about those cuts. And we also have another person here to talk about from Holy Cross about the extensive care and the need to not touch Medicare. And so what we're doing today is pretty much saying that Medicaid, Medicare, and Social Security need to be off the table when it comes to making cuts. And now I'd like to present our AFGE member who will talk about Social Security.
Okay. Good evening. My name is Althea Mowat. I am a union representative with AFGE Local 2014 and the Fair Practices Coordinator. I'm here to talk about how the cuts would affect the employees with Social Security. AFGE represents 42,000 employees across 1,500 offices. The work that Social Security employees do is important to assist the public, whether they're applying for retirement benefits or disability benefits, or just assisting them with any questions that they have. Cuts to Social Security will definitely hurt the public overall. And that's what we're pushing for. We want to make sure that we're able to continue to provide effective and efficient services to those who depend on us the most, those who are also vulnerable in our communities. And that's what we're fighting for. That's what we want the public's assistance with, so that we can keep our jobs, so that we can help those who depend on us the most. Thank you.
Thank you, and now we're here from a representative from Holy Cross.
Thank you. My name is Joey, and we just wanted to convey the importance of the Medicaid program and some of the things that people don't usually think about when we talk about Medicaid. Almost half of the deliveries in Broward County are covered in some way with Medicaid. We also have a lot of people with nursing homes that I think 2 out of 3 people in nursing homes rely on Medicaid coverage. The hospital networks here in Broward, as well as other medical providers, rely completely on revenues from Medicaid and Medicare to be able to provide services for those that are uninsured or underinsured, especially for Medicaid and Medicare services and activities. It impacts not just the hospitals, but the families and the businesses here in Broward. We are very concerned about potential cuts from Medicaid and Medicare. It makes our jobs even more challenging to be able to provide services that all of our residents need here in Broward County.
Thank you so much. And so that concludes our press conference. We'll be heading into our town hall right now so we can talk more about the effects of the cuts from Medicaid, Medicare, and Social Security. Thank you. Did you have a question?
Yeah, so these potential cuts, they still impact the state of Florida, even though we did not expand Medicare under the ACA, Medicaid, excuse me?
Absolutely. It definitely does, because we still do get a portion of Medicaid, and we have a substantial number, over 84,000 seniors and over 42,000 children who are actually on Medicaid. Those numbers do include our veterans. A lot of our veterans do have care with the VA, but any holes they have, especially when it comes to long-term care, those are our veterans. And this week, we spent all week fighting, saying that any cuts that could actually harm our most vulnerable should not be on the table. What we're really concerned about is that everything they said in Project 2025, they are carrying out. From the first cuts with Medicaid. And if you remember, when they first started making cuts, the Medicaid portal was one of the first portals that was stopped, if you recall. And then they said they didn't cut it, they turned it back on. But I think we should have been proactive back then, realizing that Medicaid was actually on the chopping block. And now for us to actually take that vote, and the way they went about us taking that vote, the pure trickery to try and get us to miss the vote was something that I've never seen or witnessed in my time in Congress. And I'll expound upon that. We all went to Congress, we went down to the floor to vote. We took 2 votes. They were about to close out the vote. They told us they were closing it out. So the Democrats were leaving, Republicans were leaving, but something inside of me said this was a trick because this bill was too hotly contested. So I stayed, and then they told us they're calling the vote right now. So we immediately had to call all the Democrats to rush onto the floor. We immediately had to hold open the vote by being in the well, and they took the vote. If they want to be honest players and be honest about what they were doing, they should have just said it and took the vote while we were all there. But even with that, we still all ran to take that vote. But what's interesting about what we're seeing now is that you hear Mike Johnson yesterday saying, oh, Medicaid would not be affected. There's no Medicaid in the language of the bill. But if you look at the application of the bill, it's impossible to cut $880 billion without touching Medicaid. If we stripped everything, you still would have $600 billion that need to be stripped. Where would you get it? The only end result is Medicaid. So I just want to be very clear with all of our constituents about what is going on. There seems to be a lot of intentional confusion, so people won't be riled up to say this madness is to stop. But I just flew in, and I want to make it very clear to everyone what is exactly going on, and so people know how to be vigilant to stop this right now.
So it's the $2.4 billion that the state gets in Medicare funding each year. That is in jeopardy with these cuts.
Absolutely.
Okay. In 2023, Florida state lawmakers expanded the eligibility of children to have access to kid care,
Yes.
which is the state's child health care program. Legislation has increased the income limits, but kid care families pay a very small premium, which is combined with state money and matched with federal dollars. Is any of that at stake?
I don't believe it is, because they're not pulling it from Medicaid. What we're looking at is that every patient who actually has Medicaid and who uses Medicaid. Now remember, Medicaid is not exclusive. There are many people who have other insurances that do use Medicaid also. So we're looking at the compounded effects. And when I say that, it's because it's not just this Medicaid bill and this budget. When we look at all the federal workers who have been laid off, let's compound that. When we look at everybody who's dependent on other services, let's compound that. And this is the first of cuts. We know they have more cuts coming down. So instead of us having this reactionary response, we need to all be proactive and understand what's coming down the pipeline and block it as quickly as we can. Right now, the House passed that bill, but the Senate does not have to pass the bill. We can all call the senators right now and let them know vulnerable adults, vulnerable children should not be on the table. Rework another budget. There's a lot of things we can cut. Why are we going to our most vulnerable?
And what are can you be just a little more specific about the Medicare or Social Security cuts that are at stake here?
Well, right now we passed the bill purely, so it went to E&C, and what they're looking for, they said for E&C, the committee, to cut $880 billion, right? When you look at it, there's some climate stuff. So let's say you took all the money out of climate, all the money out of SNAP, right? There's still $600 billion that needs to be cut. That only leaves Medicaid right now. So you would have to go in and cut it. But all of this that they're doing was already told to us in Project 2025. And so if you understand what happened, what they said, they're literally walking through it. So now we have real concerns, and we have to look at what was said when it came to Project 2025 to Medicare and when it came to Social Security. We're already seeing Social Security being impacted because so many Social Security workers are being laid off, and they're not being able to catch all the calls and get everybody who needs access to their benefits. So these are the concerns. We're being proactive, and we're also asking House Republicans to be honest brokers. Tell Americans the truth. Don't try to set us up to miss a vote. Let's just be honest brokers. If this is what you're doing, say it explicitly and we'll move forward and have to fight you on that principle.
And so programs like Medicare and Social Security, but also SNAP is also up on
Yes.
the chopping block for this
Yes,
budget round?
yes, for this budget round, absolutely. And so, like I said, we're being proactive. If you look at what they're looking at, I understand you have issues with climate. We don't agree with climate. As a Democrat, we do need to protect climate, especially here, we're feeling it. But even if you took away all the climate assistance, you have to touch on Medicare and Medicaid, and that's the problem.
Okay,
Thank you.